YouTube channel Ayurveda Basking. So today video is basically for our last paper of KUH University, that is Swastha paper 2, and we are going to discuss some important MCQ here, and they are basically previous year question along with that some like small concepts. So let's start our video. And the first question is Environmental Protection Act is on, so it is on 1986. Right answer will be the 1986 C option. Inhalation of the cotton fiber dust for a long time period lead to bisonosis. And you know, sometimes we are confused between bisonosin and bagasosis. I will give you one trick. So you can remember by the sugar cane means your sugar cane, and from sugar cane bagasosis is happening. So you can remember like cane bag, from bagasosis bag, and cane sugar from cane. So bagasosis is happening from the cane sugar. So bagasosis will be the sugar cane, and the another one bisonosis will be the cotton fiber. Anthracosis is from the coal dust, and the sidrosis is from the silica dust. Then Government of India has declared which date to provide albendazole tablet for deworming school age children. It is actually comes under the National Deworming Day, that is happening on 10th of August and 10th of February under the Ministry of Health and Family Welfare, and started in 2015. Application of disinfective measure applied after the death of the patient is terminal kind of disinfection. As you know, disinfection is of majorly of three kind, that is concurrent, just after or immediate after the discharge, maybe the sputum, maybe the vomitus. Next is prophylactic, like disinfection of the water by the chlorine. And the third one is the terminal, that is happening after the death of the patient. Children scoring the IQ 50 to 70 is considered as a degree of mental retardation. So there are 4 degrees of mental retardation, that scale: mild, moderate, severe and profound. If IQ is 50 to 70, he is a mildly mental degraded. If it is 35 to 50 means it is less, then it is moderate. If it is 20 to 35, that is a severe, and if it is less than 20, that is a profound mental retardation. So right answer here will be the option A. What is the population to be served in the sub-center at hilly or tribal backward area? For sub-center, normally if plain area is there, then the population number will be the 5,000. But here it is named as a hilly or tribal, so here population will be the less, 3,000. And the normal population for PHC will be the 3,000. The Right of a Person with Disability Bill, Rajya Sabha, was already passed on in 2016, December 14, that is RPWD bill. Scientific study of human population is known as demography. Intrauterine devices comes under the which method of contraception? So basically the method of contraception are divided into 2 categories: spacing and terminal method. In terminal method, vasectomy, tubectomy like that come, and spacing various method are come, like barrier method, hormonal pills method, and IUDs method. So spacing method, IUDs is one of the sub classification. So right answer will be the option C. Made responsible for spreading knowledge and supplying Nirod and oral pills for the eligible couple is the duty of ASHA, and ASHA is accredited social health activist in India, which is the largest voluntary organization working for the cause and care of the disadvantaged older people is basically the Help Age India. Right answer will be the option A. The number of live birth per 1,000 women in a reproductive age, so they are in the reproductive age given in a given year, is known as a general fertility rate. Drug which is used as a rasayana in geriatric diseases, ashwagandha. Like this kind of rate you just study, because from the vital statics topic 2 MCQ are there. In this PDF we are seeing so many vital static questions, so it may be a chance you can repeat from the here, and you for safe option you just see all the proportions or this ratios that is given in the chapter. WHO come into the force on 7th April 1948 and is headquartered on the Geneva or Switzerland. Any departure subjective or objective from our stage of physiological well-being is termed as the morbidity. Indian Red Cross Society was one of the NGOs that is established in 1920, and now there is around 400 branches in India. The agency responsible for preparedness of disaster management is the National Disaster Management Authority, and the chairperson of National Disaster Management Authority is the Prime Minister of this Indian Prime Minister of that country, and it is established on 2005 under the Disaster Management Act. House can be purified by, these are some of the like Vastu method for purifying the house, like Seka, Ulepa and Alepana. Which of the following method of rainwater harvesting? So surface runoff harvesting is one of the rainwater harvesting method. Which among the following is the land treatment process? So slow rate method, overflow, over land flow, all these are method for the land treatment. Koplik spoke is very important question, and it is the characteristic feature of the rubella or German measles, and in which you are seeing the bluish white spots that is resembling the grain of the salt on the reddish background. Which of the following is the type of composting? Bangalore method is kind of an anaerobic composting. Which among the following is not a hydrological hazard? Hydrological means, hydro means water, so destruction water movement, and floods is there, waves action is there, cyclone is there, but landslide is not that much due to hydrological hazard. So right option will be the B option. Which among the following is an occupational disease due to the physical hazards? So burn is coming under the heat is a physical hazard, so right answer will be the option B. What should be the ideal color for the inside wall of the classroom? Is the light green color. Which among the following is an infection is in disinfectant in the halogen compound? So bleaching powder, because chlorine is there, so chlorine is one of the halogen compound. The severe form of dengue fever that cause plasma leakage is known as a dengue hemorrhagic fever. For how many days does Government of India provide iron and folic acid tablet to pregnant women? So it is started, I think, after the third trimester, and 100 days government is providing, and after the delivery also 100 days, so total 200 days are there, but pregnant during the pregnancy course it is for 100 days. The incubation period of COVID-19 is typically 2 to 14 days, but it can vary. Who is an infant? Infant is the child under 1 year of age. The World Health Day is celebrated on the 7th April, and 7th April is actually the WHO Organization Day. Crude birth rate is calculated by the number of the birth in a year plus total population into the 1000. So number of birth by total population into 1000 is the crude birth rate. Who is the Health Minister of Kerala? Srimati Veena George. The first health policy of India was formulated in 1983, and its aim is health for all by 2000. National Malarial Control Program started in the 1953, and it is changed to the Eradication Program in 1958. And after that in 2003 it is included in the National Vector-Borne Disease Control, because malaria is one of the 6 diseases that is mentioned in the National Vector-Borne Disease Control Program. The primary objective of RNTCP is eliminate the tuberculosis from the India. What is the infant mortality rate of Kerala? It is very less, 5 or 6, like 5 and 6, and highest is found in the MP, like 59, and in UP like around 30, above the 35. National health policy is an life expectancy is 70 years by 2025. What does ART means in HIV control program? So ART means the antiretroviral therapy, because HIV is a viral disease. Typhoid fever is also known as the enteric fever. Right answer with option C. Which hetu lead to the causation of Janpadudamsam? So they are the Sadharan hetu, because they are common to all the individual, and there are 4 hetu like Udaka. Udak is there, Vayu is there, Bhumi is there, and Kala is there. Asadharan hetu is specific to individual, like Doshaja hetu are there. So here Janpadudamsa is mainly basically due to the Sadharan hetu. What is the acceptable noise level in the hospital ward? It is 20 to 35 decibel, and like below 80 is the like right answer. Then below 80 is normal. After 80 the hearing loss and all hearing abnormalities starting coming. Disaster management involve which of the following phase? There are four phases: mitigation, preparedness, response and recovery. Bisonosis is again cotton industry हो जाएगा. If it is a bagasosis, then it will be the sugar cane. Then objective of the school health service is prevention of the disease, early diagnosis and provision of healthful environment, except hospitalization of student, because we have to prevent this one. Autoclaving is a method of sterilizing that use moist heat under pressure is the right answer. The causative organism of whooping cough is Bordetella pertussis. What is the focus area of integrated child development services program? Is pregnant women, children and under 6 years is their focus area. Which among the following is an epidemic in India? To tuberculosis, accident, alcoholism, all are epidemic. Epidemic means unusual occurrence of a disease in a given particular area. Perinatal mortality rate is the indicator of mother and child health care. So right answer will be the option B. You have to comment me what is the perinatal mortality rate. Then World Health Organization headquarters is in the Geneva. Then vital statics primarily deal with the birth, death and marriage rates. So right answer will be the option B. The full form of Ayush is Ayurveda, Yoga, Unani, Siddha and Homeopathy, and it is one of the indigenous system of medicine. According to the National Health Policy 2017 of India, the aim is to increase the life expectancy of birth to 70 years. And the National AIDS Control Program launched in India in 1787, because there are so many programs, so at least you have to know their launch date and their main objective of each program, because any program can come, but most important program is tuberculosis elimination program, then leprosy program, AIDS program. These are like most important that can come for 10 marks, but along with that the small programs you have to remember, this blindness and all, because they are coming for MCQ and all. Then Swachh Bharat, which are commonly practiced, Swachh Bharat mission and NHM, then NRHM, because NRHM is one of the important concept. ASHA is given, and ASHA is coming in primary healthcare also, and from primary healthcare sure question is coming, so you must study this topic very nicely. Poliomyelitis is a disease transmitted through which of the following? It is a waterborne disease. Which state among the following is the highest literacy rate? Tamil Nadu. India planned to reduce prevalence of blindness to which level by 2015? 0.25 by 1000 people. Which drug is used in National TB Elimination Program? Rifampicin. As you know, it is one of the five drug that is used for the multi-drug therapy of the tuberculosis. Contagious disease means a disease that is spread through the contact. Next comes the person, animal, object or substance from which an infectious agent passes or disseminated to the host is source. And what is reservoir? Where it is where it is primarily dependent for its survival, and where it is reproduced is known as reservoir, but through which it passes or disseminated to host is source. So right answer will be the option A. These definitions you have to study very nicely, because 10 marks question is also coming for that portion. Here also basic you all study that epidemiology definition and that epidemiological triad, causation of disease, dynamic of disease. Along with that you can study all these things with taking any example of communicable or non-communicable disease. Then exposure to noise level above dash may rupture the tympanic membrane and cause permanent hearing loss is above 140 decibel it will happen, but here the most appropriate answer will be the above 160 decibel. Green indicate the ambulatory patient. So these are the four main color that is happening in our triage system, and I have enumerated here. So let's discuss what are these four. So first one is the red. Red means the immediate treatment, they need the most immediate treatment. Yellow means they need a delayed treatment and they are stable now but they need some observation. Then green is the minor and they also known as the ambulatory patient, and black one is the deceased or expectant who don't need treatment because they already died. Dash is not produced due to the inhalation of cotton dust. So cotton dust is produced by bisonosis. Right answer will be the bisonosis. Bagasosis, can bag you can remove. Parmalanx is different. Silicosis is from the silica. Which of the following is the objective of the school health service? promoting the positive health and providing a healthful environment to children. Right answer will be the option B. How can sputum can be disinfected? So for sputum, you have to boil and autoclave it for 20 minutes at 20 IPS pressure. And we have previous question we have discussed the autoclaving definition. So autoclaving method we are using for sputum disinfectant. The concept of population strategy and high risk strategy are the primary prevention, because in primary prevention two things are there. One is the population strategy, that is not for a specific population, therefore overall population. For example, when you reduce the smoking or the cholesterol level, then there will be the decrease in the CVS cases. So that is a population strategy for a major population. High risk strategy is for the high risk individual, particular to that individual, and this two components are coming in the primary prevention. Right answer is the option A. The minimum and recommended number of antenatal care visit for a pregnant woman is 4. So minimum is basically 4, and they are happening first in around 16 week. Second is between 24 to 28 week. Third visit is in 34 week, and fourth visit in 36 week. These are the minimum a pregnant lady should visit. But ideally there are another pattern for ideally first 28 week, once a month she have to go to hospital, and up to 36 week she have to go for twice a month. Up to 28 means up to first trimester she have to go once a month, so 3 times in 3 months. Up to 36 means second trimester she have to go twice a month, so 6 visits should be there. And after that she have to go weekly for weekly till the delivery of the baby for a antenatal care. Stools have a rise water appearance in cholera. Maternal mortality rate is defined as the obstetric death during pregnancy or after delivery within 42 days. That is the proper definition of maternal mortality rate. WHO is established in 7th April 1948. The average number of live birth per 1000 women in their reproductive age. This is the general fertility rate definition. Which of the following is not a function listed under the concurrent list of Indian Ministry of Health and Family Welfare is it's mentioned like population control, prevention of communicable vital study, but management of private healthcare institutions not mentioned. So right answer will be the option C. Which of the following is a goal to be achieved by 2015 as per the National Health Policies? Eliminate the lymphatic filariasis by 2002. By 2015. When did Government of India launch the expanded program of immunization? In 1978. Which of the following is the primary cause of chickenpox is varicella zoster virus? Option will be the C. Infant mortality rate indicate the number of children that died before the age of 1 year, because in previous question we have seen the what is the definition of infant. So infant is who is below 1 year. So right answer will be the option C. India first national health policy is come in 1983. Swachh Bharat mission was officially launched, and basically you can remember this because Swachh Bharat is basically related with the Gandhi ji. So Gandhi Jayanti comes on 2nd October and it started on 2nd October of 2014. The constant presence of a disease within a geographical area without importation from the outside is endemic, and the unusual occurrence is known as epidemic. Okay, so this is the difference between endemic and epidemic. The period before antibody were produced is known as a window period in case of AIDS. When you study this AIDS, you study this period always, because these are the specific things that we have to learn in a disease or in a program. Dash procedure is used for cleaning the rapid sand filter. For rapid sand filter, back washing is there, and for slow sand filter we have to do the scraping procedure. So these are two different cleaning procedure that is mentioned in different sand filter. The state disaster management authority is headed by the chief minister, and the national disaster management authority is headed by the prime minister. Which of the following is the type of interaction in the occupation environment? So men and physical हो सकता है, chemical and biological agent. All this interaction are happening in the occupational environment. Right answer will be the option B. Dash is the type of the desk that is advised for use in school. So minus type of desk is advised. Ergonomic desk which adjustable height. For their proper growth and all development, they can see easily through the book. Dash is not a phenol and related compound. Sablon is not directly related with the phenol. Bull neck appearance is seen in the diphtheria. It is one of the characteristic feature of diphtheria. The first visit in ANC clinic should be within 12 weeks of pregnancy. So right answer will be the option D. The peak incidence of mumps is in winter and spring. So right answer will be the option A. It is basically late winter and early spring. Keeping the baby grips the side of the mother's bed is known as roaming in. These are different terms that is mentioned for the specific care in MCH care. UNICEF Gobi companion program exclude. So out of this, oral medication it is not included, and this is the full form I have enumerated. G means growth monitoring. Then O means oral rehydration, because it's basically for the children under 6 years and the pregnant woman all. B means breastfeeding, and I means immunization. So this is the Gobi campaign of the UNICEF for children and maternal females. Which of the following is the common indicator used to measure fertility? Is the general fertility rate, and we have already seen the definition of this in previous question. The dash is the ex officio secretary of the Panchayat Samiti, is a block development officer. Objective of national health policy is to rationalize the use of drug within an allopathic system, increase the access of decentralized public health system, achieve an acceptable standard of good health amongst the general population of country. All of these are the objective of national health policy. Which national health policy has the tagline Vision 20 to 2020 and right to sight? Actually, this is for the national control program of blindness, and if we select by the eliminating option, so right to sight is always related with your eye, and eye mainly that blindness and or problem. So for that there is a program, that is National Control Program of Blindness. What is the index case in the context of the communicable disease? Indexed case means the first case that is identified by the investigator, and the trick is I for index, I for investigator. So the first case that is identified by the investigator is the index case. Maternal mortality rate is defined as obstetric death during the pregnancy or after delivery within 42 days, and this question we have already seen. It is the definition of the maternal mortality rate from the vital statics. India's first national health policy come in 1983. And next question is Swedish International Development Agency, that is SIDA, one of the bilateral agency, has been assisting mainly for blindness program, National Blindness Control Program. And the last question is the concept of the population strategy and high risk strategy are component of the prevention control. And the next question is the concurrent list in the Indian Constitution allow the legislation by both the center and state government. Which of the following is included in concurrent list? So the right answer is the drug and poison regulation. Next question is it is from the vital statics, and vital static 2 MCQ will be there. From this topic no SAQ is coming, but MCQ is important, so you just see all these ratios because they can ask, and along with that the birth and death regulation act is also there. What does the crude death rate is? Crude death rate means the number of death per 1,000 people is the right answer. What is the significance of infant mortality rate? Infant mortality rate actually measure the quality of the maternal and the child health care service. So right answer will be the option B. Which of the following stage in the demographical cycle is characterized by the high birth and death rate? Is stage 1, high stationary. Next question is how is an eligible couple defined? So eligible couple is basically a married couple, and where a wife in her reproductive age 15 to 49. So right answer will be the option B. And this eligible couple, target couple, both important definitions. Which contraceptive methods work by altering the cervical mucus and preventing sperm from reaching the egg is oral contraceptive pills. What does the pearl index? So pearl index is basically the it is failure per 100 women year of exposure, and this is due to failure of contraceptive. So right answer will be the option A. For terminating a pregnancy between 12 to 20 week, how many RMP opinions is required? Here they ask about opinion, and for this I have drawn one flow chart here. There is one act, MTP Act 1971, and amendment is happening in 2020. So some changes are there. Up to 12 week of pregnancy, if a person is doing MTP, so there should be a advice of one doctor according to 1971. But same here for 2020 also, but for 12 to 24 week there should be a advice of 2 RMP, and in 2020 it's reduced to 1. When MTP is happening in 20 to 24 week, then it is not allowed according to 1971, but according to 2020 2 doctors for the same category of pregnant women are required. And if MTP has to occur after then more than 24 week, then according to 1971 it is not allowed, but it is allowed according to this bill 2020, where medical if there is a fetal abnormality then it can be possible, but there should be the permission from the medical board, and any time during the pregnancy it can be done with one doctor if we have to save the pregnant woman life. Next question is which of the following is the latest national policy of India? So national policy is 2017, and it come on 15th March of 2017. In Telegram I have already uploaded this new national policy, you can see from there, and from this is national policy. Around there are 2 MCQs, so you just study all the important point. And in our MCQ you have seen like 2 or 3 MCQ are coming, so you just see this policy also. Which sector is primarily associated with the long-term occupational exposure leading to the disease silicosis and asbestosis? So silicosis and asbestosis basically happening when mining and construction workers. So right answer will be the option C. What is the most common health defect of a prolonged exposure to occupational noise above 85? Above 85 can lead to the permanent noise induced hearing loss if it is for a prolonged period. And in noise there are 2 kind of changes is happening, auditory and non-auditory. Auditory is one of this permanent noise induced hearing loss, then tinnitus and hypercosis. In non-auditory it becomes irritability, speech abnormality, then stress, like that. Mental health problem. Which bio value primarily decline between the age of 41 to 50 years? So right answer will be the Shukra. According to the school health service guideline, how often should a comprehensive dental examination be conducted for school children? So it should be done twice in a year. So right answer will be the biannually. What does the concurrent disinfections primarily involve? So in previous question you have already said disinfection is basically of 3 type, in which concurrent is there, terminal is there, prophylaxis is there. In concurrent we have to do the immediate and repeated disinfection after a patient's sputum or vomitus. What is the difference between the point prevalence and period prevalence? Prevalence means all the new and previous cases, and it's basically of 2 type, point and period. Point means at a specific point we are doing the prevalence, and period prevalence which when we are doing over a time period or time interval. So right answer will be the option A. Which of the following is not considered a source of vital statics? So vital statics senses are the sources. Then survey like the National Family Health Survey is also sources. Registration of birth and death are sources, but school attendance record is not that much source. So right answer is the option C. Where is the headquarter of UNICEF? So UNICEF headquarter in the New York City. Right answer is the option C. At what interval is the pentavalent vaccine is given to children? So pentavalent vaccine is given to 6 week, 10 week and 14 week. You have to comment the answer of what is the pentavalent vaccine, what all are vaccine coming in this pentavalent. Which of the following is a common example of latent viral infection? Is right answer the herpes simplex virus. How is leprosy primarily transmitted? It is transmitted from the droplet infection from the nose or the mouth during the close contact. One tablet of chlorine is effective to disinfect how much quantity of water? A small tablet is for 20 liter and a large tablet for 200 liter it can disinfect. Baga sauces occur with the sugarcane fiber, and the trick I have already told. Baga sauces and the trick is bag cane. So you cannot can bag. So cane sugar can lead to bagasosis, and the another one can lead to bisonosis, that is cotton fiber. Next question is, at school 1 sanitary latrine is recommended for 100 students, and 50 student 1 urinal should be there. Next question is, standard against which disinfections are measured is phenol. Which term refer to the number of new cases in a given disease occurring during a specific? So new cases means incidence, and if all the cases new and prevalent new and previous cases are there, then right answer will be the prevalence. Which of the following is example of waterborne disease? And cholera is a well-known waterborne disease. Which of the following is a key factor in determining the spread of epidemic? So right answer will be all of the above. There should be healthcare availability, seasonability, socio-cultural factor. What is the example of zoonotic disease that causes an epidemic? So epidemic is an unusual occurrence, and zoonotic means that is transmitted by the vertebrate animal to a man. So right answer will be the rabies. It is a well-known disease that is concerning epidemic and having a zoonotic origin. Dash is the type of morbidity resulting from disaster. So disaster can cause all this morbidity. It can cause injury, it can cause emotional stress because of livelihood lost and the houses destruction and all. Epidemic of the disease. So right answer will be the all of the above. A pregnant woman presented with the pallor, shortness of breath, lethargy, palpitation as our Nidana paper wrote. So you can assess this. All are the iron deficiency anemia feature. Iron deficiency anemia feature. So her blood examination revealed hemoglobin level is 9 gram per dl. In your opinion, what would be the probable diagnosis? So it is anemia, and we have to give her folic acid, so iron tablets. So right answer is the option A. A trained dye center for a population is for 1000 people. Right answer will be the option A. National health policy was introduced in dash 5-year plan, 5th, and till now there are 3 main national health policy: 1983, 2002 and 2017, and the latest one is 2017 that is working now. Headquarter of WHO is at the Geneva. Right answer will be the option B. Record of the birth, death, marriage and divorce gathered through a registration system maintained by the government unit is known as the vital records. So it is not given in options. Right answer will be the none of this. ASHA is postages at the village level, and you have to comment me the full form of the ASHA. Next question is, the vitamin A supplement administration in prevention of nutritional blindness in children program contain 1 lakh IU international unit per ml for 6 to 11 month children, and if a child is 12 to 36 months, then the dose it will be the 2 lakh IU, and it comes under the vitamin A prophylaxis program 1970. Next question is, national health policy is based on? So national health policy is mainly based on the primary health care. Option A is the right answer. Pulse polio examination is immunization is administration of OPV to the all children below 5 years, and that is done in the 1 day. That's why it's known as a pulse polio, and irrespective of or regardless of their previous immunization schedule. Blood smear must be made at night for filariasis because the filariasis worm is found in the peripheral circulation around 10 p.m. to 2 a.m. night. So that's why its blood smear is taken at night. As per National Health Policy 2017, aim is to reduce the prevalence of tobacco use by 30% in 2025. Okay, thank you guys.